And in the business school, we have the reputation of being cold calculating technocrats. We know how to crunch numbers. We know how to calculate returns on investment. But when it comes to healthcare, in healthcare, there are very important and powerful values that come to play. And the most important value is the value of the patient. The keynote speaker today will bring the human side of healthcare back to the forefront. So we are very excited to have the opportunity to explore the human side of healthcare with actress, professor, and playwright Anna Deavere Smith.
Fact is that many, many people in our world are vulnerable and feel let down by systems. And so let me down easy means, if you're gonna just drop me and make me rubbish in this society, if you're just gonna not make it possible for me to pull myself up by my bootstraps, which is what I thought was a part of this American dream. If you're gonna let me down, don't do it so hard. Don't do it so mean. Let me down easy. I started with one question with every patient: what happened to you? And they were telling me everything. When you have a crisis in your life, you start to create all kinds of narratives to preserve your human dignity and to preserve the sense of your humanity. I mean, one of the things we can do as humans is tell stories. My dog can't, but we can. And so as long as you have breath and voice, or as long as you have any way of communicating, you can try to say to somebody what this means to you. So, it took nothing to get from people what I call accelerated expression. I got insurance, Blue Cross of Idaho, family policy, $260 a month, cover all of us. Then we got a $7,500 deductible, which is stupid. We don't ever meet that. I mean, all this paying money, and then we got to pay $7,500 for them to meet it. They're just trying to rape us. Like all the people that got the money, they rape the poor to pretty soon, or they rape the middle class till the middle class becomes poor, and then they're going to start raping the rich. And they're gonna break the whole country, I think. But basically, I'm an optimist. I had some bad experiences with my daughter when she went for her dialysis, and they hooked her up to the machine, and the nurses went down the other end of the hallway and left her in this room hooked up to this machine, and I sat there with her, and something happened. The thing came loose, and the blood went all over the whole room, all in my daughter's ear, all in her face, and I went running down the hall trying to find a nurse, and I couldn't find a nurse. I looked in rooms. I was calling for help, and nobody came for at least I'd say every bit of about 3 to 5 minutes or 5 minutes. It was a long time, and the blood just kept coming out from the thing, and my daughter was just crying, and the blood was all in her hair, it was all in her face, it was all on her jeans, and it gotten on me, and it was squirting all over, and it was like a nightmare. And so finally, when they come in, they put a sheet on top of her, on top of all the blood, and unhook her from the machines and everything, and then tell me, well, I could bring her back another day. And that, she's soaking wet with blood. They'll do the dialysis another day. I could bring her back another day. And I said, okay. And they just put a sheet around my daughter, a sheet around my daughter, and I didn't have a car at that time. Well, I had a car, but my car was in a shop, and we had to wrap her up in a sheet with the blood going through the sheet and whatnot, and put her in a taxi and bring her home. And so that made me have like a real bad feeling about nurses and doctors, and how could they just do this? And I'm not just saying it because it was my daughter, but my daughter was a beautiful girl. And she died. So I'm not having any dialysis. You know what I loved so much about working at Charity Hospital? Every single patient that walks through that door has gotten the shit end of the stick in life, period. But through my interactions with them, I could treat them like they're the Saudi Arabian princess coming to the Mayo Clinic. There is absolutely no reason in the world that I can't give everybody top of the line, best medical care. But that got kind of difficult when things started to deteriorate around here during Hurricane Katrina, and that whole veneer that you could take care of poor people and you could take care of them as well as you take care of rich people, that veneer, those walls came down. That just fell. 100% of the nurses on the floor are African American, and the African American nurses and the other people who work at Charity said two things to me early on. They said, one, they opened the levees on us. They said they opened the levees on us, meaning they flooded the poor areas of Orleans Parish to spare the other parts. And two, they said to me early on, they're not going to come and get us. We're going to be stuck here. And here I am, coming from my position of privilege in the world. What do you mean? Of course they're going to come and get us. What do you mean, of course they're going to come and get us? But my patients really did sense. And that part made me ashamed. And I thought, you know what? It must feel like this your whole life, just that feeling that we have to do for ourselves, just that feeling of being abandoned. That was all new for me. Being abandoned? No. It was all new for me. But for my patients, it was just one more thing. And the people who work at Charity Hospital, it was just one more thing. And they just went about their business. Every nurse on that floor worked for 6 days in that heat with no power, with flashlights. They never missed a vital sign. They never missed a urine output. They never missed a trick. And with a heavy sense of resignation. And so that hole that I always tried, you know, hey, you're here at Charity, but don't worry about it. We're going to give you the best possible care. Well, you know what? We are going to give you the best possible care, but we can't make FEMA or the government come and get us.